One of our radiologists at Mayo Clinic, Dr. Hilary Garner. She's an assistant professor in radiology, did her undergraduate and medical school studies at University of Florida, so she is a Gator. She's been on staff at Mayo Clinic, Florida since 2010 and has extra training and specialty interest in musculoskeletal medicine. So there's many times I'm walking over there saying, what am I looking at? And she's always gracious to say, what am I looking for? So you do a good history and a good physical, that'll guide us to what type of images we want to do. And she's been, again, a fantastic colleague to help us figure some of the complex cases out and some of the common uncommon. So Dr. Garner is going to present with us here and talk about what's that thing there, which I ask her all the time. And again, thank you for hanging in there. We're in the home stretch.
Thank you for that very kind introduction. That's actually one of the most fun parts of our day in the reading room is when Dr. Montero and his other sports medicine and orthopedic colleagues come in and visit with us, because we just really enjoy discussing cases with them directly. So our learning objectives are to review some urgent and emergent radiographic findings in the sports medicine arena. We'll also go over some that are not so urgent or emergent, but still need appropriate follow-up and management. Hopefully I'll also, as I go through this, decode some radiologist jargon or buzzwords that you may encounter when reading imaging reports. And as part of this presentation, we'll also review some important findings on commonly performed MRI exams. To start off, it's important to note that imaging is not always needed. However, if imaging is indicated, as Dr. Ortiguera emphasized, and I will also strongly emphasize, always start with radiographs. Very few exceptions to this rule. Acute head trauma, facial bone trauma, radiographs just aren't nearly as good as maxillofacial CT in that regard, or acute cervical spine trauma. Advanced imaging that includes ultrasound, CT, and MRI should be used in specific clinical scenarios. Ultrasound is excellent for superficial tendons and ligaments, trying to decide whether something is a ganglia or a soft tissue mass. And as Dr. Presley spoke with us earlier about, it's also quite good for nerve impingement issues, although those are overall fairly rare in the sports medicine arena. CT is excellent when we have complex fractures or fracture dislocations that you see on radiographs, and the orthopedic surgeons need to know some more anatomical information about how to best fix that. MRI is excellent for soft tissues, including tendons, ligaments. It's also excellent for marrow around the physes and the tissue